So we're gonna now talk about how to do your exercises to improve finger mobility and thumb mobility. So if you have stiff fingers, you will start working on making a fist. Try to make the fist first as best you can. And once you can only go a certain place, you take the other hand and come on the back side of the bad hand. Make your fingers kind of rest on the finger that you're going to stretch. Take your thumb, put it on the nail. This finger is going to push down, the thumb is going to push in. And then you'll stretch the finger out. And you'll do that with each finger. So make a fist, start coming in. Now I'm on this finger. Come down with this finger, and then put the thumb like right on this knuckle first, and then slide it down to the nail, and then straighten it back out again. And then do each finger, pull down, press into this little part of the joint, and then right on the nail, and then open. Everything should be done very slowly and within your ability to bend the fingers, your pain tolerance. So you're going to come down with the little finger on top, slide in, and then open. If it's just one finger that you're dealing with, then you're going to do it just with that one finger. If the other ones are okay. So each finger should be done if it's the whole hand or just the one that you need to work on. And make sure you go both directions. You can also put your hand flat, and you can lift each finger up as high as it goes. So the thumb can go about right here on this knuckle, and then you got the finger coming up. Thumb here, lift the finger up. Thumb here, lift the finger up. And then just make sure that you do active bending, active extension. If you're having a hard time bending, you can put something in your hand and try to reach around it. We may give you one of these little foam tubes where you also can hold, and maybe a little bit wider. So you're trying to work on touching whatever you're going to be having in your hand, and open and close around that. Okay. You can also use something as small as this. So depending on how much you are stiff, you can use different diameters. You can start on the top, and we call this pen rolling, or this in this case is a spoon rolling, where you're going from the tips of the fingers and rolling in and rolling out and then opening. Okay, so you can do it also a pen rolling or a spoon tip rolling. And then the active lifting, you can do one at a time, or you can do all of them, or you can kind of fling your fingers. You can bring your fingers out. You can bring your fingers in like that. You can make your thumb. If you have index finger tightness, you can make your index finger slowly go down to the bottom of your thumb and come back up again. So in and out like that. And then your thumb, you can put your thumb flat. You can stretch your thumb out. You can bring your thumb in. You can do that several times. You can turn your palm up. You can bring your thumb as far as you can. Take your index finger, put it on top of the nail. Place your thumb on that back side of the thumb and start working on bending it in and lifting it back up using your index finger. So the thumb really doesn't move. Your thumb stays there and guides your thumb down, and your finger kind of presses it in. If you notice that this joint is not bending, you can actually press more on the top of this knuckle, and you'll see this joint bend. Then you can slide down to your nail and then come back up. You can also put this thumb and this finger together, and you can stretch your thumb and your index finger and come back in. So I call this the triangle and stretch to a flame. Triangle and stretch to a flame. And then the active movement of your thumb, you want to touch each finger to your thumb into each finger, 1, 2, 3, 4. Reach down to the bottom of your little finger and then reach out. So 1, 2, 3, 4, go down your little finger, go out. Or put your hand flat. We call this making the L shape. So if you can only do a V shape, you can give it a little assistance to make that L. And then come back in. And then come back out as wide as you can and give it a little lift. And then you're going to come up and down, up and down, up and down, or you can come in and up, in and up, and in and up. So those are the fingers and the thumb exercises.